Yes, thank you. So, we were presented new data during this International Epilepsy Congress about indirect treatment comparison, treatment use in Dravet syndrome. So Dravet syndrome is a really devastating disease. Most patients are inadequately controlled with standard of care, so they request additional add-on therapy. And right now on the market, you have a stiripentol, fenfluramine, and cannabidiol. Stiripentol was a first-in-class, best-in-class drug, and fenfluramine and cannabidiol were developed later on. But for their clinical trials, they didn't include stiripentol as an active treatment. So what we decided to know and to do is really to compare efficacy and safety for these three drugs. And we decided to use a robust methodology, network meta-analysis. For that, we decided to have a strong literature review to see which data we would like to select. And the most appropriate data were 2 placebo-controlled randomized clinical trials for each single drug. So in total, 6 trials. And we decided to compare for efficacy on the outcome of the monthly convulsive seizure frequency. And what we would like to compare is the percentage responder rate. So first we compare for patients who can at least reduce of 50% their seizure frequency. And what we could see, there is any difference between stiripentol and fenfluramine, but it's higher compared to cannabidiol. For the outcome and decreasing at least 75% of seizure, we could see almost the same result. Stiripentol and fenfluramine, no difference, but better than cannabidiol. And for the last outcome, 100%, that means seizure-free for patients, so a really strong and profound response. We could see a difference. Stiripentol is doing better and statistically significant compared to fenfluramine and cannabidiol. What we would like to do as well is to compare the safety profile to be sure that there is any difference, and we consider serious adverse events and discontinuation for serious adverse events, and we didn't see any difference between the three drugs. So what with this work, we could conclude that stiripentol as a first-line add-on therapy in Dravet syndrome is at least as effective as fenfluramine and more than cannabidiol in reducing convulsive seizure with no greater risk of seizure adverse events. So we could consider stiripentol as a backbone treatment for Dravet syndrome. And we are publishing this data soon. So right now we have fully guidelines to treat Dravet syndrome. First line is valproate, and as I mentioned, stiripentol, fenfluramine, cannabidiol are add-on therapy. So in a way to better know which profile and which patient could benefit of which drug, it could be in a way a better help for physicians. And as well, we could consider the cost effectiveness of this drug. And with that, we could have a better value proposition for stiripentol.